Hi, my name is Rob Daigle from Gulfcoast Ultrasound. I'd like to give you a hot tip for the day, something that I've learned over the years of carotid imaging to improve the carotid image, particularly on the internal carotid. Many novices who are learning how to scan carotids often scan from an anterior approach, an anterior lateral approach, and trying to identify the internal carotid artery coming off the bulb. One of the problems is that as they scan up the neck, they run into the mandible, and then they can't go up any higher in the internal carotid. This is the bulb area here, or the beginning of the internal carotid, and this is the ICA. What I've learned over the years is to use the jugular vein as an acoustic window into the internal carotid artery. And this means that I'm going to scan from more of a posterior lateral position. I'm going to turn the patient's head to the side somewhat, and I'm going to come in from the posterior lateral aspect and identify the jugular vein, which is right here, and then use this as an acoustic window to see the internal carotid artery. So this does two things. Number one, the probe position doesn't interfere or doesn't strike the mandible, so I can scan up higher in the ICA. And also I can see this far field wall and the near field wall quite a bit better by coming through the jugular vein, as there's less attenuation of the signal. So again, rather than scanning from an anterior approach to try and identify the ICA, come in from a posterior lateral approach, use the jugular vein, and we can see a much greater length of the internal carotid artery with much better clarity. So that's your hot tip for the day. Now you give it a try.